I get shots for the wet.
For the wet macular degeneration.
Mm-hmm.
Okay. How long have you been getting? Are they the anti-VEGF shots?
I don't know what is that. I take drops for pressure.
Okay. And how do you know what your most recent eye pressure was?
It was just a couple weeks ago. I think it was, if I'm not mistaken, it was 18 and 10.
Okay. Are you using eye drops in the eye that had the 10 pressure?
Yes, I put them in both daily.
And did your ophthalmologist say anything to you about maybe going off the drops for the eye that has a pressure of 10?
No, they just don't say nothing. They just keep me on it.
Okay. Well, I'm going to caution you. 10 is not terrible by any means. 12 is kind of the optimum
Uh
pressure.
huh.
But when you get to like 6, you get in those single digits, you can suffer a condition called hypotony. And hypotony means that the pressure in the eye has gotten too low.
Oh,
So you suffer the same set of issues as when the pressure is really high. You don't get
right.
any
I've
oxygen in
noticed
the
that.
eye, you
Yes,
don't get the
ma'am.
right blood flow, and the optic nerve suffers damage.
Yes, ma'am. I have noticed that.
Okay, so you might want to. How many drops do they have you on every day?
Well, the blue cap one is twice a day, and then the green tap is at night.
Okay, so is that latanoprost or
I don't
you don't
know.
know what they are? Okay, that's okay. But just for everybody else's education, I just want to talk about what wet macular degeneration is. Wet macular degeneration, also called neovascular age-related macular degeneration, is a serious eye condition that affects the macula, the small central part of the retina responsible for sharp, detailed vision, used for reading, driving, and recognizing faces. And it says in wet macular degeneration, abnormal blood vessels grow beneath the retina and the macula. These fragile vessels leak blood and fluid, which causes the macula to swell and become damaged. This leads to rapid and severe loss of central vision if not treated. So, and the symptoms are, it says wet AMD often develops suddenly and may include blurry or distorted vision, central vision, a dark, empty spot in the center of vision, reduced color or brightness or contrast sensitivity, difficulty recognizing faces or reading. So, and the typical causes are aging, genetics, smoking, high blood pressure, obesity, poor diet, sunlight, chronic inflammation. Can I ask you another question? Are
Yes,
you diabetic?
yes, ma'am.
Okay. Have you been diagnosed with diabetic retinopathy?
No, ma'am.
Okay. So the eye drops that I would recommend for your situation, because you're going to stay on your prescription meds for a while longer.
Uh
The
huh.
things I would recommend are 4 and I, 40/60, and the C Clear with DMSO. Those three drops are the drops I'd recommend for you. I'd want to speak with you to actually get you on the right regimen, of using these drops and make sure that you understand exactly how to use them in unison with your prescription drops.
Yes, ma'am.
Um, but excuse me just a second. Okay, well, come on. Just baking soda. I'm sorry. Um, my daughter freaking out. What was I gonna say? I'd want to get you on the right regimen, using the drops the right way, so
Okay.
that you can keep your pressure down,
Yes, ma'am.
actually have restoration of your eye health regarding the wet AMD. What's going to happen is you're going to get better blood flow
Yes.
through the vessels, the blood vessels that are supposed to be in the eye,
Yes, ma'am.
those neovascular vessels that just wind up getting created because you don't have enough blood flow. Those will automatically get shut down and absorbed back into the eye system.
Uh
And
huh.
then you have more oxygen because you've got better blood flow. And we will deal with any dry eye issues, which I'm sure you have.
Yes, ma'am.
Okay.
I have another problem too. Is I have a little hook that comes down, uh, like if it's a line. You know what a heartbeat looks like? It looks something like a heartbeat.
It's in your eye?
It's on in my vision. Yes, ma'am.
It's in your vision.
Yes, ma'am. That's
Okay.
it's like on the edge of a let's say like a 90 degree. It, it, it's on the edge like a little V hook,
Okay.
and it's both the vertical and horizontal, but it's just on the edge of things that I see. It's not in the center or anything like that.
Is it black?
No, ma'am. They're whatever your color is that you're looking at. It's just a disform on the edge.
Oh, okay.
Disform.
So, but it takes on the color of whatever you're looking at.
Yes, ma'am. Yes, ma'am.
Hmm. I wonder. Hang on. Let me just look something up real quick.
Okay. They say it can be fixed, but through surgery, and I could possibly lose my vision more.
Well, who wants that?
My eye doctor told me that. I'm a VA patient. I don't go to a outside doctor.
Okay. I've had a few customers, more than a few, that are dealing with VA doctors also.
Yes, ma'am. I didn't develop a lot of this stuff until I had cataracts taken off.
Well, and that tends to happen. The cataract surgery, it causes just as much trauma to the eye as it fixes.
Right. Just like some medications do worse than what you've got, the side effects.